Hey folks, Professor Finn here, and today we're going to be looking at Chapter 10 in Embalming History, Theory, and Practice by Sharon Gee-Mascarello, the Embalming Analysis. Let's go ahead and get started. The embalming analysis includes all analytical observations of the deceased human body before, during, and after embalming. Analysis incorporates the disciplines of anatomy, pathology, microbiology, chemistry, and restorative art. Observation and analysis and corrective treatments continue until the time of final disposition. Periodic monitoring of the body for adverse conditions is the professional duty of the embalmer, and this is something that people fail at all the time. You can't just embalm the body, put it back into the morgue or refrigerated storage, and then pull it out 5 or 6 days later and hope for the best. You need to be checking things. Post-mortem body conditions, embalming treatments, and any post-embalming corrective treatments are documented on the Embalming and Decedent Care Report. Vintage embalming textbooks described hundreds of diseases, poisons, and traumatic modes of death. Treatments were concerned only with the specific pathology, specific poison, or specific trauma. No condition was given to the various intrinsic and extrinsic factors, such as the time interval between death and preparation, and evaluation of all other observable postmortem changes. A specific embalming treatment was outlined for each condition. In the mid-1950s, the method of body typing was introduced. Dead bodies were classified by the conditions exhibited rather than by the specific cause of death. Professor Ray Slocum of the Dodge Company produced a detailed system of body types based primarily on the time between death and preparation and the degree of post-mortem advancement. 6 categories describe specific chemical formulations necessary for the preparation of the body. Body typing was based on a recipe method. The embalmer followed a different recipe for treatment of each different classification, and variations of the Slocum method of body typing, now called pre-embalming analysis, continue today, most importantly, without the cookie-cutter specific recipes. The practice of medicine underwent radical change in the 1960s with the extensive development and use of new medications. The embalmer had to consider the influence of therapeutic medications upon post-mortem conditions in addition to consideration of all other post-mortem factors. Y'all need to bring back this stuff. Like, absolutely, we need to see more of this in public. It's not just for the runways of fashion. It's for shopping malls and especially Walmart runs. Embalmers consider the sum total or aggregate of factors that are specific to each decedent. Every dead body is treated with respect to individual embalming requirements. Embalming analysis is applied during each phase of embalming, divided into 3 time periods: before embalming, during embalming, and after embalming. So the present day analysis is divided into 3 time periods: before embalming, during embalming, and after embalming. And there are 4 steps involved in an embalming analysis: observation and evaluation of postmortem conditions, proposed methods of treatment, implementation of treatments, and observation and evaluation of treatment results. What do you see? How do you fix that? Try doing that. Did it work, yes or no? And then, what do you see? How do you fix that? Try that. Did it work, yes or no? And you repeat this cycle the entire time the body is under your care until the body has been processed for disposition. Decedent confidentiality must be strictly observed beyond the workplace. Shared information within the workplace is conducted on a need-to-know basis. Communication between various funeral service professionals, primarily the embalmer and the arranging funeral director, and between the professional and the deceased's family are encouraged. Fancy way of saying you need to be talking to people and letting them know what is going on and what the condition of things are. When a body comes in and it is bright yellow from severe jaundice, you should be telling the family and painting a very realistic expectation that, did you see your father at the nursing home? Did you see your father at the hospital? Did you see whoever, whenever? You saw they had a bright yellow discoloration. That is called jaundice. That is not something that can be flushed from the system. What this means is that we are going to have to be using heavy cosmetic. So If you're going to view your father, if the public is going to view your father, we'll make every professional attempt to make sure the cosmetics look good, but using heavy cosmetics is going to be a reality. Observation and evaluation of these factors help the embalmer to formulate embalming treatments. Body conditions including age, weight, musculature, body build, immediate cause and manner of death, effects of disease and or trauma, effects of drugs and medical treatments, postmortem physical and chemical changes, postmortem procedures, refrigeration, autopsy, organ and tissue recovery, the postmortem interval between death and embalming, and the post-embalming interval between preparation and disposition. This aids in determining how do we position the body, what are the ways we're going to close the mouth and eyes, what are we going to do for visible antemortem swellings that need to be reduced, treatments for removing or altering visible antemortem discolorations, techniques used to raise sunken or emaciated tissues, what vessels are we going to use for injection and drainage, how strong are we going to make the embalming solution, how much of that embalming solution are we going to make, what type of pressure and rate of flow are we going to use during this injection? Necessary supplemental treatments and delayed or immediate cavity treatment following arterial injection. The correct embalming treatment is dictated by the conditions present in the body, not solely by the cause of death. Very few causes of death determine the embalming technique. 3 examples could include death from a contagious or infectious disease, because the CDC or your health regulatory agency is going to tell you what you can or cannot do. Death from a ruptured aortic aneurysm. If your aorta suffers a huge hole, you're going to have to do a 6-point injection because you can't build up any pressure. You have a water main leak. In death from renal failure, where you have a buildup of nitrogenous waste in the tissues of the body, which means you're going to have a lot of counteraction to your preservative. So you are going to use very, very strong preservatives in an effort to combat that. In making an embalming analysis, 3 important guidelines should always be considered. The body must be continually observed and evaluated during all phases of embalming. Prepare each body as if an infectious or contagious disease is present. Observe universal precautions and terminal disinfection protocols. Prepare each body as if viewing and final disposition will be delayed. It doesn't matter that they are viewing tomorrow at 6 p.m. What if that changes? You have to have a plan in place. The American Board of Funeral Service Education provides guidance as to the factors that should be considered. So, intrinsic factors, body conditions, pathological conditions, microbial influence, moisture, thermal influences, nitrogenous waste products, weight, gas in tissues or cavities, as well as cause and manner of death, presence or absence of discolorations, postmortem physical and chemical changes, effects of pharmaceutical agents, illegal drugs. Tons of things to worry about. And then there are extrinsic factors, things on the outside of the body, atmospheric conditions, thermal influences, external microbial influences. You have microorganisms in your intestines. We have them on the surface of everything in our environment. Vermin and other things that could come up into play. Time intervals. What is the time between death and preparation? What is the time between preparation and disposition? And what is the embalmer's preference for things that we are going to do? Do we like raising femorals versus raising carotids? Those things come into play. Embalmers consider 4 major factors in making a pre-embalming analysis. The first is the general conditions of the body. What can you visually see? 2, what effects are being produced by disease or possible disease processes? Are there any effects happening as a result of drugs, pharmaceutical agents, illegal drugs, or surgical procedures? And finally, what are the effects between death and the embalming? We have to make educated guesses. Now, the good news is this is not a magic 8-ball. What do I do here? This is something that over time you will simply get better at, and you will have the skill and experience to address all the issues. Sensory mechanisms such as sight, touch, and smell allow the embalmer to observe and evaluate post-mortem conditions. Most often, the embalmer does not know at the time of the embalming the cause of death or the medications which have been administered. It is also in this phase that treatments must be considered for antemortem conditions produced by trauma or surgery, postmortem events such as refrigeration, autopsy, organ and tissue recovery, and the postmortem changes that have occurred in the body. Additional information may be obtained from the following sources. If you're lucky enough to get a death certificate or a preliminary death certificate, you can get some information from that. Infectious or contagious conditions of the deceased provided by the medical facility. Usually they'll put a sticker on a body bag or a container that says Versa, MRSA, E. coli, staph, so you have an idea that you are dealing with some level of infection. Information concerning the timing of the memorial event and final disposition. Embalmers should know when things are going down or if things are waiting to be planned. Shipping information to another funeral home in the same or foreign country. Locations outside of the native country may require specific treatments, and it's good for you to know that ahead of time. Specific requests from the next of kin or authorizing party, especially when it comes to grooming of facial hair and other cosmetic treatments. So first up, general intrinsic body conditions. Intrinsic conditions of the body include age, body weight, build, musculature, protein level, and general skin condition. So when we are working with children or infants, one thing we know right off the bat, arteries and veins will be much smaller than in the adult. Specially sized instruments are needed for injection and drainage. Solution volumes will also be lessened. Embalming solutions cannot be assumed to be milder. Infants and children often require stronger solution strengths. This is because infants especially, they are filled with water. They have so much more water content than an adult human. So you have to make sure you put in a stronger preservative because that water accelerates decomposition. Now you can't go too heavy because of the fact that if you pull too much water out, you'll encounter dehydration and wrinkling of skin. But you can't just go in with a weak solution because, oh my God, it's a baby. You have to go in at normal or even slightly higher injection concentrations. 2%, 2.25%, maybe 2.5%, depending on the chemical that you're using. Higher body moisture and additional complications related to disease processes, medications, and the accumulation of toxic waste as a result of organ failure require stronger solution strengths. A needle injector may not be suitable for mouth closure, especially on infants because they don't have any bone. It's all cartilage, and a needle injector requires bone to be effective. So you may be relying on suture, you may be relying on adhesives, and positioning for children is usually different than that of an adult. Conditions such as arterial sclerosis and arthritic legs may eliminate the use of femoral arteries as an ejection point in advanced old age. Absence of teeth and dentures may create feature-setting challenges. This is why you really do want the dentures if they have them, and if nothing else, you will be using a mouth former. Suturing may be needed for mouth closure when the bones of the jaw are porous and prevent use of the needle injector. Just because they're calcified doesn't mean it's useful, especially if the bones are brittle and frail, because you go to use a needle injector, and that is basically a little mini impact hammer. And I have had cases with osteoporosis where we've tried to use a needle injector, and it breaks the bone. So suturing, a combination of suturing and adhesive or adhesives, there are things that you can do, which is why you have to be able to run the gamut when it comes to closing the mouth and setting features. Conditions such as arterial that is actually the same slide. Emaciation, solution strengths may need to be reduced and humectant co-injection fluids added to create natural moisture in tissues. Dehydration may create challenges with eye closure and mouth closure. When you have an extreme emaciation case, you will likely not be able to use tons and tons of tissue builder to make the face look normal as it did prior to emaciation. The goal is to lessen the appearance of the emaciation. But if you try to eliminate it, you may see that the body looks broken. It looks wrong. Obesity, femoral vessels may be too deep to use for injection, or you'll have to make larger incisions and work from deep inside the incision. Very large quantities of arterial solution will be needed, and if not, you have to go higher in concentrations. The internal jugular vein will afford the best drainage site. Restricted cervical injection will best control arterial solution entering facial tissues and reduce swelling, and there will be positioning challenges. So, heavily muscular individuals. Well-developed musculature usually assimilates preservative well. Protein in muscle tissue readily absorbs preservative, except during stages of rigor mortis. Intense rigor mortis will prevent good distribution and diffusion of the solution, so you may want to wait until after rigor mortis is passed in the case of someone like this. And what happens is your muscles are competing for the same real estate as all the other tissues of the body. So your muscles have these holes where the arteries and the veins run through them. And when we are injecting, we want that artery to swell from a flattened condition to an open condition to allow for the maximum rate of flow. If the muscles are locked in, those arteries are only able to swell as much as the muscles that are now locked will allow them. So you either have to be patient or you're going to cause problems. And with intense rigor mortis, you may not be able to position the body the way that you would need to position it. When wasting diseases, poor musculature, senile, or atrophied tissues are present, the embalmer can expect incomplete firming of the limbs. If the muscles are in bad condition, even if you're using a very firm fluid, you might not get the results that you expect. And swelling may also be expected if large volumes of mild solutions are injected, which is an opposite problem. Senile, loose tissue does not assimilate the arterial solution as well as healthy, firm tissues. The cause of death may not be known at the time of embalming. However, the embalmer can observe the effects that disease has had on the body. For example, jaundice may be caused by the effect of drugs in the liver or red blood cells, obstruction of the bile duct, hepatitis, cancer of the liver, and hemolysis of red blood cells. What matters is you see jaundice. And then from there, you treat the jaundice. And if that works, great. If that doesn't, what is the next thing that you can do to treat? It is the condition of jaundice that concerns the embalmer, not the disease that caused the jaundice. The same disease can produce different conditions in different persons, so treat the jaundice. The embalmer is presented with a thin, emaciated, dehydrated subject. The primary cancer of the stomach is less significant. You have a thin, emaciated, dehydrated subject. So what are you going to do? You are likely going to inject a mild solution or a milder solution right at 2%. You're going to add a humectant into that. You're not going to grab the Power Tone Vivid. You're not going to grab the Intrafine with Dynachrome. You're probably going to go with something much milder. And if you have to use something heavyweight, you're probably going to grab something like Triton 28 and try to be very gentle with what you're using, or Regal, or something of that nature. The intended enlargement of these structures bears down upon and obstructs the cisterna chyli, the lymph collecting station of the abdomen and lower extremities. This prevents the lymph from returning to the venous system from these areas. All of the parts drained by the system will become edematous and ascites will develop. So you treat the ascites. How do you treat the ascites? There are ways you can do that, either a co-injection for edema, or you inject a stronger solution intending that the secondary dilution will be stronger. You can wick, you can channel. There are things that you can do. The primary cause of death is cancer. In one case, we have a subject with edema, ascites, and anasarca. On the other, an emaciated, dehydrated subject. So if you just did something on cancer, you would have a problem. You have to work with what you are seeing. And they give another illustration. In incompetence of the right atrioventricular valve of the heart, the valve fails to close efficiently. Whether the excess fluid is a result of cancer of the viscera or damage to the heart valves, edema is edema. The embalming treatment is the same. By the same token, because you don't have enough examples at this point, emaciation, whether caused by cancer of the stomach, actual starvation, or pulmonary tuberculosis, requires the same basic embalming treatment. Further inquiry into cancer shows that obstruction to the passage of bile into the intestinal tract can lead to the very common embalming challenge, jaundice. This condition can also be caused by obstruction of the common bile duct, a disease not usually related to cancer. Here again, we treat the symptom. Embalmers treat symptoms, not diseases. A disease that is as common as cancer and can produce as varied a group of postmortem conditions is arterial sclerosis, because again, you don't have enough examples. Depending on the vessel or vessels involved, we can get a wide range of different embalming chances. The embalmer must not overlook the fact that any 2 or 3 diseases can and do coexist. So each disease exists in 2 or more forms. Therefore, a patient can die with stomach and liver cancer. A patient can have liver cancer and cerebral arterial sclerosis. You have to treat what you see. In reality, an embalmer should ask what conditions exist rather than of what did the subject die. It's good to know what they died of so we have an idea. If we get something back that says myocardial infarction or stroke or whatever, we have an idea of what we may run into. If we just go in and start running and we see that half the body is getting solution and half the body is not, we can infer it's probably a stroke. But how we treat it is exactly the same. We're going to raise arteries on both sides of the body, and we're going to inject from both sides of the body. That's simple. That's simple. If we know ahead of time, we can go ahead and we can prepare a second injection site and go from there. If the conditions are identified and properly treated, the embalming procedure will succeed regardless of the disease that caused the condition. Deep breath. Drug treatments and surgical procedures. Since the 1960s, there has been an increase in the therapeutic use of drugs. Like the hundreds of diseases and their effects on the body, it would be impossible for the embalmer to embalm a body using chemical formulations designed to combat the effects of a specific drug. Most often, a patient is given combination of drugs, often over a long period, and a drug does not always produce the same effects in each person. It is important that the embalmer have an understanding of the possible effects of drugs and of the fact that embalming challenges often stem from long-term drug therapy. Some effects of the long-term use of medications which can affect the embalming of the body include, and it lists a number of these things. So, swelling of facial tissues can be related to steroids. It can be related to a heart surgery. It can be related to blockages. Alopecia can be related to cancer treatment. It can be related to a medication. Again, we treat the symptom. We do not treat the actual drug or the disease. The one axiom that can be universally applied to all chemotherapeutic agents, common drugs, is that they are toxic. Cellular changes occur when they are used, and no matter which drug is administered. Even the relatively innocuous aspirin pill has its effects. Drugs have an effect on the skin, circulatory system, liver, and kidneys. Such changes may be comparatively minor in nature, limited to slight discolorations that respond readily to cosmetic treatment. When changes are major, such as acute jaundice or saturation of the body tissues with uremic toxins, the fixative action of the preservative in the arterial solution is seriously impaired. Fancy way of saying, when the drugs you are taking, whether it's prescribed or not, start causing waste to build up in your tissues, the solution becomes very ineffective. You have to put higher concentrations to get the same job done because it's being neutralized by the garbage that is lying in your tissues. Drugs that thin the blood in life will often reduce postmortem blood clotting in the vascular system. Reduced postmortem clotting will improve distribution and subsequent diffusion of the arterial solution. Blood thinners like heparin and others will make your life easy to establish drainage. Blood will flow out very quickly, which means you probably want to put some pressure in there before you go ahead and take drainage so that you're not just establishing a path of least resistance and then have problems later. Bodies that exhibit a midline scar over the sternum, that's telling you they've had heart surgery, which may involve heart repair, valve bypass, something went on in there, and you can make some assumptions. And the main assumption is you might have problems getting distribution around. In the medical setting, anticoagulant or blood thinning medications are administered during surgical procedures. Keeping the blood thin will increase postmortem hypostasis of the blood and intense livor mortis in the dependent tissues. If the blood is more liquid, it will pool quicker. If it pools quicker, then you'll have livor mortis as a discoloration much more apparent. Good news is you can flush it. The bad news is if it takes too long between death and prep, that's going to turn into postmortem stain, and that is going to start to gray when it hits preservative. Expansion of the veins in the distal arm will be noticed when the arms are lowered to the sides of the body. Vessel expansion distension is an indicator that good distribution of the embalming solution can be expected. One of the common techniques embalmers use is we put the arms over the side of the table and let gravity help us get stuff in there. And once we see that stuff is flowing in, we'll put the arms in the normal viewing position so that way it gets extra resistance on the way out and pushes into more areas. Choice of embalming technique may be greatly influenced by whether death occurred during or immediately after surgery. Surgery could be the primary factor in an analysis, especially if it's heart surgery or aortic repair. During these procedures, the heart may be stopped for a period during which an artificial means of life support is used. Frequently, if death occurs during or shortly after this type of surgery, the face and neck are grossly distended with edema. Repair of an abdominal aneurysm may not always be successful, and the interruption in circulation will necessitate sectional arterial injection. Abdominal surgery on the bowel can result in peritonitis, intense distension of the abdomen, and bloodstream infections, which means extra clotting. These conditions require the use of a strong, well-coordinated arterial solution. Whenever death follows surgery, there exists the potential for leakage from arteries and veins involved in the surgical procedure. The embalmer should use dyes to indicate the distribution of arterial solution. It may be necessary to inject a greater volume of arterial solution to compensate for solution that may be lost to the abdominal or thoracic cavities. All surgical bodies should undergo thorough cavity treatment. The formation of tissue gas is always a possibility. Be certain a liberal amount of undiluted cavity fluid is injected into the area where the surgery was performed. The best practice is to inject additional cavity fluid into the tissue surrounding the surgical incision. Reaspiration and reinjection of the cavities are anticipated. Do not be afraid to go in and reaspirate. Some embalmers just standard practice. If there has been a surgery, they will open the surgical incision. They'll put on compresses. They will treat it as flaps. They may even make the incision larger and treat the open wound as autopsy flaps, and then suture themselves very thoroughly and then do thorough cavity treatment. One of my practices that I would do no matter what is if it was a surgery, I would always aspirate and re-inject. Pre-embalming analysis includes observation and evaluation of changes that occurred during the postmortem interval between death and embalming. The types of body conditions will determine the embalming treatment. We treat the symptoms. What do you see? Treat what you see. Accelerated changes can take precedence over less advanced postmortem factors. Consider that a person who dies of cancer is emaciated and jaundiced, and the body is not discovered for several days. If the environmental temperature is very high, postmortem changes will be accelerated. Advanced decomposition conditions will determine the strength of the embalming solution, despite consideration of other postmortem conditions. If the person was emaciated, but they are actively decomposing, retaining moisture is not going to be your concern. Halting the decomposition as much as possible is going to be your concern. As a general rule, best results are obtained when embalming is done as soon as possible following the death. 3 postmortem conditions that interfere most with good distribution of the arterial solution are blood coagulation, rigor mortis, and decomposition. The 3 postmortem conditions that interfere most with good distribution of the arterial solution are blood coagulation, rigor mortis, and decomposition. Embalming the body before these changes are established helps to produce better results. This is why so many funeral professionals want to get the embalming done as quickly as possible to get the best results. If there is a delay between death and preparation, mortuary refrigeration will help to slow the onset of some postmortem changes. Cooling of the body helps to slow postmortem blood coagulation, the onset of rigor mortis, and decomposition. However, over extended periods of time, refrigeration can create disadvantages such as dehydration in some areas, increased blood viscosity, postmortem edema, intense livor mortis, and postmortem stain. If the fluids in your body have time to drift into other places, the places they are leaving are going to dehydrate, and the places they are going to swell. And if there is more water in an area, it will more rapidly decompose than areas without the liquid. So you have to be monitoring your bodies. Post-mortem interval between death and embalming continued. Refrigeration can also create false signs of preserved tissue. Tissue firming is caused by the solidification of fats in the subcutaneous tissues. Hemolysis produces discolorations that resemble dyes used in the embalming fluids. So two things are happening here. When fats get cold, they get hard. If you have grease in something and put it into the refrigerator, it's going to turn into solid grease. Same thing happens in the body. So what you may think is firm is actually just cold fats. The second thing that happens here is hemolysis, the breakdown of blood. And as that leaks into the skin, that might be an indication to you looking that, oh, the dye finally got there. The problem is that's not dye, that's byproducts of blood decomposition. And that will start turning gray when you inject solution and you have the formaldehyde blood reaction. So you might have to do some counterstaining. The second part of the analysis during injection of the body is an evaluation of the treatments during embalming. When a challenge is encountered, the embalmer must decide what new approach to take to solve the challenge. During this phase of analysis, after the injection of each gallon of arterial solution, the embalmer reevaluates distribution, diffusion, and the results produced. The entire time that we are embalming the body, we're paying attention to what is changing. The following areas are some concerns. What areas of the body are receiving arterial solution and which ones aren't? Which areas are not receiving arterial solution? What can be done to stimulate the flow of arterial solution to areas that aren't getting arterial solution? What areas must receive sectional arterial injection because they're not getting fluid otherwise? Has the body as a whole received a sufficient arterial solution, and has the solution been of sufficient strength? Has sufficient arterial solution been retained by the body? Is the arterial solution having too much of a dehydrating effect on the tissues, which you may or may not know immediately? Should additional fluid dye be added for internal coloring of tissues? If purge begins from the nose or mouth, what are its origin and cause? Because that may be telling you that you have to change something. Are tissues actually firming? Are you using the right type of chemical to give you that firming? And does another site need to be selected for drainage? So if you have to jack up your arterial solution strength, well, you could flush and create a whole new solution using a higher index arterial fluid. You could add a higher index arterial fluid to your present solution. This is why you always want to keep a bottle of Intrafiant Old Time Color or Trauma Care, depending on using Dodge or Pierce respectively. So you can just pour a bottle in there and it will increase your formaldehyde content because they have inactive dyes, which means it's not going to affect the color that you are getting from whatever your primary arterial fluid is. And you could add more concentrated arterial fluid to the present solution. So flush, create something completely new, add some Trauma Care, or just go ahead and add more of your arterial fluid that you are using, because that inherently is going to give you a higher percentage. So post-embalming evaluation. The embalming analysis is an ongoing process from the time of receiving the decedent into the embalmer's care until the final disposition of the body. You are constantly checking. During the process of post-embalming monitoring, the embalmer continues to check for adverse changes on a periodic basis. Adverse changes could be the presence of gas in the tissues or cavities, odor, purge, color changes in visible areas, and skin slip. If this sounds familiar, because these are the cardinal signs of decomposition. You are checking to see if anything didn't take, and the way you do that is by looking. By looking and smelling. If you think something is going iffy, just go ahead and treat it. Get ahead of it before it becomes a problem. When an embalmed body has been received from another funeral establishment, an evaluation must be made of all body areas. Some of the following treatments may be necessary: re-injection of a particular area, supplemental preservative treatments such as cavity packs and compresses, hypodermic injection, cavity reaspiration and re-injection, and also the resetting of features. When you receive a body from another funeral home, you should be taking steps to make sure that body is in good condition, documenting things when things are problematic, and talking to all the relevant parties to make sure that everyone is on the same page as to what is happening and how the body has been received. Embalming analysis is an ongoing process from the beginning of the embalming to the disposition of the body. In this third phase of analysis, an evaluation of the preservation of the body is necessary. Areas that are still lacking solution must now be treated using the supplemental preservative treatments of hypodermic injection or surface embalming. That's the moral of the story. Especially if you're running out of time and don't have time to re-inject sectionally, or you've already re-injected sectionally and it didn't really do anything for you. Some of the following considerations are evaluated during this third phase of the analysis. What body areas have not received arterial solution after primary and multi-point injections are completed? Should cavity embalming be done immediately after arterial injection or delayed several hours? And we will be talking about that in the cavity injection chapter. Are the features set properly? Did purge develop during embalming? Is the body well groomed? Are the body and hair clean and dried? Have decubitus ulcerations been treated? Or have bed sores been treated? Is there any leakage? Are tracheostomy and colostomy openings closed, and are incisions sutured? Periodic monitoring allows the embalmer to make adjustments and perform treatments necessary to ensure ongoing stability of the body after embalming. The following must be addressed and treated appropriately to serve this purpose. So, dehydration. Dehydration can be caused by excessive embalming solution strength. You went overboard. Gravitation of tissue fluids from the face and dependent neck into dependent tissues. Moisture loss to the surrounding environment exacerbated by direct currents from air conditioning or heating systems. Inadequate distribution of embalming solution to an area. You might say, well, hey, if I don't get a lot of embalming solution to that area, how is that going to cause dehydration? Because the fluid can still move. Because the air will evaporate. Because the pores are more porous and are still open, so when air flows over the top, it will wick moisture out into the environment. Surface tissues may be corrected with cosmetics and waxes. Feature dehydration may require hypodermic injection of tissue builder, cosmetics, and waxes, and you may have to reset your features. When a body is dehydrated, we have to think of like complete dehydration. When you start injecting a body, you may see that the body is so starved for liquid that it'll immediately start to assimilate the liquid and start to swell out. So if you set the features while the features were dried out, the lips might get too puckered as they swell back out. So you'll need to adjust things. If it's a needle injector, you're going to have to sit there and undo the barbs and reset them. If it's a suture, you're going to have to pull the bow and then retie accordingly. Purge requires immediate correction. Evaluate to determine the origin of the purge. Reaspiration of the cavities and repacking of the orifices are necessary. Evaluate the need to re-inject cavity fluid. Purge is caused because there is gas or pressure pushing something out of where it is. The best way to get rid of that is to simply aspirate it and then apply cavity fluid, which should kill anything that is causing the gas buildup. Clothing may be soiled, and if it is, you're going to have to remove it, launder it, dry clean it, and then put it back on the body, which is extremely embarrassing, by the way. Don't be afraid to use plastic garments. Evaluate to determine the origin of the odor. Untreated tissues continue to decompose. It's not going to stop just because you found it. You have to treat it. Re-embalming may be absolutely necessary. The same or additional arteries can be injected, and a waterless solution is recommended when you find yourself in this type of a situation. Reaspiration of the cavities and repacking of orifices is likely to further reduce odors. Evaluate the source of leakage. It could be edema, could be an embalming incision, it could be a pinhole caused by an IV needle that was removed. You would be surprised how much liquid will come out of any hole in the body. Treat the affected area. Soiled garments may need to be laundered or dry cleaned. And a quick way to do that, will be to go ahead and, when dealing with pinholes, is cautery chemical. Go in, channel, add some phenol, and smush it up. Plastic garments are recommended to contain minor leakage and add preservative and absorbent powders inside the garment. Tissue softening occurs with continued decomposition. What is going on here? My phone keeps dialing someone. I'm going to turn this phone off. Tissue softening occurs with continued decomposition. Discolorations, blebs, and desquamation are common, so blebs are little water-filled blisters. Re-embalming may be necessary. You're absolutely going to be doing some surface treatments because things are going bad. You need to get it under control. Tissue gas requires immediate correction. It is foul-smelling. It is foul-smelling. It swells quickly. Gas will be creeping. You'll touch the skin. You'll feel the gas kind of moving along. That's called crepitation. Re-embalming is necessary. You have to go in with the proper type of solution to kill it. We'll talk about methods of treating tissue gas, and essentially what you do is you create a firewall of chemical so it can't creep any further than the area that it's in. Tissue gas can be catastrophic to a cadaver, and it will be absolutely devastating to a family if it gets into visible areas. So you have to take steps immediately to get it under control. Folks, that sums up this chapter. We will see you next lecture.